while. You've been incredible.
My name is Laura Jones. I'm a women's health advocate and a public health student. The event today, Let's Talk Women's Health, a space to be heard, was really important because I wanted to provide a way for women to process their questions and their health issues in a room full of experts that are actually able to give them answers to help them advocate for themselves, whether that's in a GP surgery, whether seeing a consultant or at work, or with their families, that they have the language to explain what they're going through.
I've worked predominantly in public services most of my career, and I find it very, very strange that when half of your population are women and are menstruating and have hormone-related difficulties and very specific health problems, it's very interesting to me that maybe we don't always tailor our care to that, even though it's affecting such a large population of people. Even if it's not something diagnosable like a PCOS or PMDD, the fact that as women we have a different sort of or as people who menstruate, we've kind of got a different sort of biological setup, and that can influence, like for me, I'm a mental health clinician, so how that impacts the mind and how that impacts our emotions and thoughts. The fact that we're not concentrating on that sometimes, I find very confusing.
This girl getting the chances of endometriosis and getting worse.
First of all, there are a lot of women's health. People think it's complex. It's not complex. I think sometimes the women make them complex by themselves, not talking about it. You know, it's a cultural thing is there. People don't talk about periods. And sometimes, you know, it comes with the moms had painful periods. When the daughter says, I have pain, oh, it always happens. But no, you should not normalize things. Periods should not be so painful, causing problems.
We have this beautiful kind of car crash where we're not researching problems enough, we're not listening to people well enough, and we're not sort of taking things as seriously as we should be.
The biggest misconception about women's health is it's just a period or it's just hormones. Whether that's any kind of health condition you're having, people just assume she must be on a period.